So good afternoon, everyone, and welcome to today's webinar, where we'll give you an update on what's new and what's changed at Mindbeacon. My name is Nick Reuter. I'm a research advisor with AMO and the AMO Enterprise Center and with LAS, and I'm pleased to be joined today by Anthony Sam from Mindbeacon. I think most of you already know that AMO partnered with Mindbeacon in the spring of 2020 to offer members a digital platform to help you, your staff and dependents access effective mental health care through the convenience of a personal device like a smartphone or a tablet. The Mindbeacon approach is therapist-assisted, internet-based cognitive behavioral therapy delivered privately and securely through the Mindbeacon digital platform. And AMO is pleased to be offering this digital solution to members, which aligns with the provincial mental health strategy, particularly on innovative ways to provide mental health therapy and create positive mental health outcomes. And this is especially needed during the ongoing COVID-19 pandemic, where more than ever, people need access to effective mental health supports. So the timing of our partnership with Mindbeacon was coincidental, right around the beginning of the pandemic, but we are certainly happy to be providing quality mental health support to our members, their staff, and their families during these challenging times. So there have been some enhancements to Mindbeacon's workplace mental health program, and Anthony will shortly go into more detail on how their new therapy program works. And we also aim to walk the talk at AMO and LAS with the programs and the services that we offer our members. And I'm pleased to say that AMO is offering the Mindbeacon platform to our employees. And so with that, I will introduce our speaker. Anthony Sam is Business Development Director at Mindbeacon, and he has previous business and financial experience in roles with Cubic Health, CCM Consultancy, and with Investors Group Financial Services. And so with that, Anthony, I'll turn things over to you to get things started.
Thank you, Nick, and thanks for that warm welcome to the webinar. And good afternoon, everyone. As Nick mentioned, as I'll be going through quite a bit of information just in terms of what's new and what's changed at Mindbeacon. But I want to start off with just essentially it says that, mental health PPE. And if we think about, prior to the pandemic, many organizations or many people, and I'll say for myself, when we thought about PPE, I wasn't even aware what PPE was. But nowadays, if we talk about PPE, is everyone knows exactly what PPE is for, particularly for COVID-19. And if we can relate it back to, Mindbeacon is mental health PPE, meaning that we are a prevention tool, as well as we treat individuals that have chronic mental health conditions, such as with chronic depression, as well as anxiety and even insomnia, which I'll talk a little bit more in a little bit more detail. So hopefully that gives you a little bit more context in terms of, the mental health PPE concept. The agenda for today is we're going to go through four things, but also just understanding the continuum of care. And I want to share some Mindbeacon clinical results, particularly our overall book of business. And one of the things that we've been hearing quite a lot about is, short-term disability increasing because of mental health conditions, as well as long-term disability. And because that has been one of the topics over, over these number of months, these are obviously at a cost to the organization. We are going to be, I'm going to be sharing some of the results with you. So as we take a look is, this is a growing concern in terms of, in Canada regarding mental health, the impact on the Canadians. We see those figures consistently, but what are the impacts on the workplace? We see productivity is, that area of productivity, how productive are people? And then also absenteeism. We've also heard from organizations that, absenteeism continues to increase because of mental health. People call in maybe the day off, but we see those numbers quite significantly. And then the last one is prescription drugs, which is, we've seen a relative amount of increase over the past year or so of about 15 to 20%. And one tip I can give everyone just in terms of prescriptions is if you look at your prescription drugs, particularly for mental health, for depression and anxiety, we know that, if we talk about a few years ago, that those particular drugs were quite expensive. So in terms of cost, if you look at your drug reports in terms of cost, you may have seen these costs being quite a bit. That being said, if we fast forward, 4 years now, is that a lot of those drugs, because their patents have expired, there's a lot of biosimilars out there, and it's pretty cheap now in a sense that it costs organizations about $1 a day to treat individuals that are taking medication for whether it be depression and anxiety. So if you're currently seeing, those dollar figures about the same as 3-4 years ago, what that really tells you is there's quite a bit of people that are taking drugs for mental health drugs for anxiety, depression, or even anything that they need help with from a mental health point of view. So just in terms of giving you positioning and understanding, these are the impacts we see in the workplace. And when we take a look at mental health care today, which is really important, and the trends that we are seeing. I'm going to share a few trends over here, but I'm going to point out a few that I think is really, really important for everyone today. In particular, when we look at the first one, where a lot of organizations, and this is changing, we saw that 90% of support and resources was for physical illness, things like, obviously cancer, diabetes, and all those sorts of things, those chronic illnesses. And that being said, we are seeing organizations shift in terms of also making sure that individuals are, that organizations or individuals are supported from a mental health point of view. And we are seeing in terms of, organizations just shifting a bit of that money, but more importantly, investing in people, because really, most often people may have a mental health, but they don't report it because, they may be embarrassed, which becomes that stigma, as well as, maybe not be able to afford to get to see a professional. And then the other one that I want to touch on very, very briefly is this unmet treatment that we see. About 60% of people do not receive treatment due to that stigma, also the accessibility, and also the cost. And what Mindbeacon has done over the past number of years is we've really focused on destigmatizing mental health, as well as providing access, as Nick mentioned earlier, through whether it be your smartphone or even through or even through a computer. So these are the few trends that we are seeing. There are so many out there, but I wanted to bring this to everyone's attention because these are the things that are going on. And we do have, the reports on the slide at the bottom, at the bottom of the slide, if you want to reference anything. Now, one of the things that the other area that I took a little bit more a deeper dive into was there was a report very recently. I believe this report was released in October of last year, and they did a survey amongst employees, and this is for mental health, and this is what they found. Whether it be the major depressive, general anxiety disorder. But what really, really struck me was the next slide. In the same article, it spoke about the employee and family assistance programs, where, even though they had reporting systems, return to work programs, they still had a significant amount of people that continue to experience anxiety, depression, burnout, as well as panic disorders, as well as that suicidal thoughts. Now, one of the things that we see significant, quite a bit of at Mindbeacon, is an increased amount of organizations coming out for an RFP for their EFAP programs. Now that tells us something in terms of where they are, where the EFAP programs are, or where this industry is heading towards. Because as some of you may know, is that prior to this COVID-19 or the pandemic, the EFAP was used in inverted commas for mental health. Now, that being said, it's not that it's not working, it's just in terms of what the offering is and in terms of the costs have still been going up, even though organizations have an EFAP. Whether you look at drug costs or you look at short-term disability costs or long-term disability costs, those costs are still going up, but EFAP has always been around. So really, we got to question and say, are these programs really working? And more importantly is how effective are these programs when individuals do use them? So hopefully that gives you a little bit more insight in terms of where this industry is heading. And we did some surveys amongst organizations, as well as spoke to HR leaders. And I'm sure some of you are reading some of the comments as on the slides, just in terms of what you hear from your employees. And many of you, I'm sure, can relate to some of the comments that you can see over there. And also, in terms of HR staff are frustrated, and some of you may have come across these comments, just thinking for yourself in terms of your daily working with, whether it be disability costs, or employees are taking leave of absence from their jobs. You don't know if these programs are working. So these are the things that we are hearing, and we want to help organizations to we'll never negate any of these. We'll never get rid of them, but we will certainly be able to help in terms of some of these comments that people do provide. So hopefully that gives you a little bit more insight of what employers are telling us. Now, I'm going to turn to just in terms of a little bit more about Mindbeacon and where we fit into where we fit in and how we fit in. And like I was saying earlier, is one of the key things that we've been doing is ensuring that we reduce the barriers to care. So if you can think about your current employee, all your employees, and one of the employees may need that assistance, need to go see a psychologist or registered social worker, and back in the day, or even now, we still hear that individuals, they may go see a psychologist, and we know that process of booking that appointment with a psychologist, or once a week, driving there, and then actually going for that treatment. And all that treatment maybe lasts an hour or so, but the overall time that they spend, over a course that they go maybe for 6, 7, 8 sessions, depending on the individual, can be quite costly. Sometimes we see it between $3,000 to $4,000 for that particular time spent with the psychologist. So if you keep that in mind and you think about, is there a better, more effective, and provide individuals that access, and also the cost. Think about in terms of Mindbeacon, and that's where Mindbeacon is so effective, where individuals are able to do the therapy in the comfort of their own home, on a break during work, or even late at night, which I'll touch on some stats later on. And really, in terms of the intake, is what we want to do, or what we try to do, is really mimic in terms of individuals going into a therapist's office, where they complete the assessment, and the assessment is based on the DSM-5, and typically individuals take approximately about 20 to 25 minutes to complete this assessment. And it is a rigorous assessment, so we do capture a lot of information. And once the individuals have completed this assessment, like I said, it takes about 20 to 25 minutes. Then the assessment is sent to one of our therapists. The therapist reviews that assessment. And then the therapist really assigns the individual to a protocol. So meaning that, let's say, for example, the individual has, has noted that they're suffering from depression. We will assign them to a protocol, the depression protocol. But 90% of the time, we do see a comorbidity. So it may be depression and insomnia, for example. So this is very common, where individuals, the number one reasons why for coming in is maybe depression, but they also show signs of that comorbidity. Like I said, let's say insomnia. And here is in terms of how effective in terms of the treatment is. The treatment is with the same therapist from the beginning of therapy right till the end of therapy. So the therapy normally takes between 8 to 10 weeks. It really depends on the individual. Also important to note that there's no scheduled appointments, like scheduled appointments for the individual to go, to drive somewhere. It is at their own leisure, meaning that they can message it, and it's all done through asynchronized messaging, meaning they can message the therapist today, and the individual the therapist will get back to them within a few hours. So what happens in terms of the therapy? The therapist is able to customize and personalize the therapy according to the individual's needs. So it may be, like I was saying, an example of depression and insomnia. So as the individual goes through the therapy, our therapist does customize it. And what also happens is every 7 days, we provide individuals what we call an outcome measure, just to measure in terms of how they're doing with the therapy, but more importantly, ensuring that there's a therapeutic alliance with that therapist, because that is so important. Is over time, when they do build that relationship with the therapist, what we do see is individuals are more open and the therapy is a lot more successful, but that takes a bit of time. But keep in mind is the therapy goes on for approximately 8 to 10 weeks. Once the individual is completed, they still have access to all that information indefinitely. So whether it be the messaging with the therapist, or even the reading material, the videos that they've gone that they've reviewed, that the Mindbeacon therapist has assigned to them for an indefinite time. And the reason why we do that is to assist individuals in case they have a relapse. So in case there's a relapse, maybe 6 or 7 months down the line, they're able to log back into their account and they are able to review that information again. The key, a few key other things is, in terms of the cost, that treatment that I've just described to you is $500 per case. So $500 per person per case, that's the amount that individual would pay. But we do have a preferred rate for AMO members, which I'll go through later on. And in terms of the effectiveness of individual in-person therapy versus the ICVT or the guided therapy that I just described, the outcomes as well as the effectiveness is just as effective as in-person, if not better when we look at all the reports and the research that has gone on. So hopefully that gives you, in terms of just a little bit of an idea in terms of what Mindbeacon does from a therapy point of view. Now, some interesting data that I also wanted to share is that what we've seen over the past few years is that we've seen about 48% of people that come in have never ever engaged in a therapist or engaged with a therapist before. And then 52% of individuals, they've had treatment before, but perhaps it hasn't addressed their issues back then, so their needs back then. So they've come to Mindbeacon and we are able to assist these individuals. And the 48% is really quite alarming, because these are individuals that, maybe through this pandemic, they've really struggled and decided to reach out for the help that they need. The other very interesting statistic that I want to share with you is just in terms of when people are accessing Mindbeacon. And what it says here, 56% of people access it after hours and 44% during office hours. One of the key things that we've also measured and really took apart just to understand the data a little bit more is the peak hours, if you will, is probably around between 9 and 12 o'clock in the evening. So what's really interesting is that people are messaging their therapist at that particular time, but not expecting a message right back, because obviously the therapist guided program is not a 24-hour service, but we do have other 24-hour services. And what that tells us is that individuals, even though they don't have access, live to a therapist, that they still have that connection with a therapist. So keep that in mind in terms of when you're thinking about different programs. These are the things that we are hearing, or these are the things that we're seeing as we move through. Now, as we move to the next slide, this is really in terms of what has changed at Mindbeacon. We are currently looking at a navigator in terms of navigator approach where, and the reason why we're looking at this, everyone, is because more often than not, when individuals, employees are faced with a challenge, when they need some support, the reality is that they don't know where to go. They focused on, their problem, and they maybe they don't want to go to HR, or maybe they don't want to go to the supervisor. So that's the reason why we are introducing the navigator, where the navigator would be a chat function or even a telephone call with a Mindbeacon representative, where if we need to, we'll want to understand in terms of what their challenges are, but more importantly is if they're suited for an EFAP program, their EFAP program, we will direct them to the EFAP program at the organization, or even if there are other supports. So keep that in mind in terms of where we're going with the Mindbeacon. That hasn't been launched as of yet, but it is coming in the next few months. Now, if we look at the 6 services that we have here, is Mindbeacon has really focused on that, what we call that continuum of care. And I'll start off at the bottom and go through each one very, very briefly, but really, the Stronger Minds information and education. That has been around since about a year now. And this was our response to the pandemic, where individuals, it's free across Canada, where individuals can get information about whether it be depression, anxiety, insomnia, self-isolation, talking to kids about the pandemic. And this is really information where individuals may be just wondering, and they may be on the fence in terms of therapy. So that's where individuals get that education and information. Now, we've also recently introduced the real-time peer-to-peer support. We've partnered up with Togetherall, a company that has worked worked with peer-to-peer support for a number of years. And really the idea behind over here is it's a community. So there are different chat groups. So there may be chat groups for example, first responders, where individuals can go in and it's a community of first responders, or individuals that have, let's say, depression or anxiety. They may have a chat group or a community. And the idea behind this is individuals may just want information about understanding what challenges other first responders had. Is it the same? And individuals may want to go for therapy or thinking about what therapy is about. And this is an opportunity for them to go and ask questions and just chat about in terms of what their needs are. And keep in mind, this is all confidential and all anonymous. And more importantly, we do have what we call a wall guide that is present, meaning that there is a healthcare professional there in case individuals show signs of maybe suicide or self-harm. The wall guide is there to assist those individuals and also help them to, we would like those individuals to self-identify. And then the therapist direct messaging. This is really very, very new. We're currently launching this. Actually, we've launched in 2 provinces, and this is currently just direct to consumer, not available to employers or plan sponsors as of yet. But the idea behind this is that it's very similar to the therapist guided program, the one that I described in detail. The only big difference is there's a very short assessment up front, which takes about 5 or 6 minutes to complete. And then the individual would be directly connected to a therapist. So there's no readings per se, there's no activities. But if the therapist feels that they need to assign, for example, a sleep tracker, they would assign a sleep tracker for insomnia. And this is, again, all asynchronized messaging. I went through the therapist guided program, which I spoke about earlier. And then live therapy, this was launched earlier this year, where individuals have access directly to a psychologist or a registered social worker. And what I've been hearing from employers and many organizations out there is the wait times to access maybe a psychologist or even a therapist, just a regular therapist. And this is where we've been able to launch this program where individuals can have access to a therapist, whether it be a registered social worker or a psychologist, within 24 hours, as long as there is availability. They're able to book that appointment and have their therapy. And then the 24/7 crisis support, that's exactly what it is, crisis support, where individuals can text. We've partnered up with Kids Help Phone over, for crisis support, and we've seen, people obviously do use it, and thankfully there's not so many people that are using it, but it is used and it is live. So these are, a number of new initiatives or new products that we have launched at Mindbeacon, and we continue to develop new products at Mindbeacon. And really, the idea behind this is to provide individuals choice in terms of where they are on their mental health journey. And we really want to meet them where they are on their mental health journey and provide individuals that continuum of care. Now, how do we do this in terms of working with organizations or just understanding the back end of everything that we have? We are all HIPAA secure, as well as all our therapists go through rigorous training from the start. They do have an intake, and that does take 3 to 6 weeks in terms of training, and then they do have a supervisor with them that works with them for a period of time. And we've used a lot of our data from over the years, because we've had in-person clinics for approximately about 10 or 15 years, and we've used a lot of data to build what we currently have at Mindbeacon. The program content, there's screening, there's readings, as well as exercise books and multimedia. And then organizations do have access to program success, whether it be data, a data analytics program manager, year-long campaigns, and sustained awareness, which is a key part of what we do. So hopefully that's given you, just in terms of what we're doing at Mindbeacon as well as how we do it. And I wanted to turn, just in terms of what the results that we are seeing. So just in terms of where we are, 2020 and 2021, this is the reasons, the main reasons why people are coming onto our platform. 39% of people come for general anxiety, 32%, but we are seeing a significant amount of people coming onto our platform, which I'll share some numbers with you. Now, in terms of our results, here are some of our results. This was published or given to us earlier in early April, so they're still pretty new, where we've seen 82% of individuals experience improvement, 67% of individuals have significant improvement, as well as the severity. So if I can explain this very quickly, is severity at the start, meaning that when individuals have completed their assessment, we have a certain score in terms of depending on what they score, they would be severe, moderate to severe. So this is when they have completed their assessment. And then severity at the end, how we measure that, you may remember I mentioned, is we measure this by individuals completing outcome measures. So they complete these outcome measures every 7 days. And then at discharge, so once we discharge the individuals, then we measure again in terms of what their severity is at the end. So we can see a significant amount of people, 66% of clients end up with treatment with mild or subclinical symptoms, which is, these are very strong results, and we continue to build this data to provide to organizations as well as share with people like yourselves. And then just in terms of, this is particular to depression and general anxiety, because these are the highest areas that we're seeing individuals coming for. Again, we're seeing, in terms of the clinical improvement. So this is once individuals have started and finished the treatment. Finished their treatment when they have completed their the treatment with the Mindbeacon therapist. Now, one of the areas that we have also dug a little bit deeper on, and some of you may have, in your benefits plan, first responders. So this is particular to first responders, where we are seeing individuals, the primary concerns that they are coming in for, and we have seen PTSD, this red part, 9%. It used to be around about 3%, and we've seen an increase over the past year. And again, first responders, again, this is particular to them, where we saw 81% of individuals have experienced improvement, and then 65% of individuals clinically significant improvement, which is again strong results. One of the things that I was saying earlier is just in terms of what we're hearing from organizations, particularly on the disability management side. And I thought I would share some results from our disability management, because we are hearing from organizations where costs for disability are increasing quite significantly for some organizations. And I wanted to just share this very, very quickly in terms of, we did a study with Manulife Disability over a period of a couple of years. And these are pretty recent in terms of those of individuals who access Mindbeacon within 3 months. These are the type of results that they've seen when they do access it within 3 months. The key point over here, everyone, is the early intervention. So even before individuals do go on short-term disability, the key is to get there to help them with that. So what I refer to the mental health PPE, is that early intervention is so key. So hopefully this gives you a little bit more insight in terms of Mindbeacon and some of the disability management that we are looking at and the results. And then just some comments from Donna Carbell, from the head of benefits at Manulife. She has really jumped on this opportunity, not only to provide her comments, but also to continue to partner with us at Mindbeacon when individuals do go on a disability. They do provide individuals the choice of using Mindbeacon. And then here again is just in terms of, this is particularly to disability, where we see the improvements of 76% experience improvement and 51 significant improvement. And then again, comparing the severity at the beginning of when they complete the assessment. And then these are people, like I said, on disability already. and then individuals that have completed the therapy and are discharged and hopefully on their way back to work soon with the return to work program. And then what I thought I would also do is provide you just a quick comparison in terms of, where we are in terms of quantifiable health improvements, where the overall mental health, the workplace, so the results in terms of our overall business, and then in terms of individuals accessing Mindbeacon within 3 months when they are on disability, and individuals accessing Mindbeacon after 3 months, longer than 3 months in terms of their results. So you can see, we see a significant amount of improvements, in terms of when people have that early intervention. So again, this is just to demonstrate in terms of the importance of early intervention and also the importance of individuals, if they are on disability for mental health challenge, is they can use a Mindbeacon. If you do have a carrier that you want them to use Mindbeacon, please reach out to me. Happy to work with you to instruct or work with your carrier to use Mindbeacon for cases where individuals have a mental health challenge. Now, one of the questions that I get so often with when talking to municipalities is, we all know that the Ontario government has been so generous in terms of providing Mindbeacon as a free program. And just in terms of the differences, as you can see, the workplace mental health program, it really demonstrates over here in terms of if organizations do work with Mindbeacon directly, you can see all the services that you would get while working with Mindbeacon directly. If organizations do, continue to promote the OTN project through the Ontario government, you can see in terms of what you have access to, which is these ones at the bottom. You get a significant more in terms of, if organizations do partner up with us, because there is a lot of awareness, a lot of education, and also that sustainability over a period of time. It's not that I remember talking to an organization and they said to me, well, Anthony, I don't want this just to be a tick box. I want this to be, yes, the tick box, but it needs to be continuous on a weekly or even a monthly basis, so that people are aware that this is available to them free. Now, one of the other things that I will share with you is that we've been working with the Ontario government for approximately about a year now. And what we have seen, I just checked the numbers just a few minutes before we jumped on this webinar, and we have seen just about 21,000 Ontarians come onto our platform to engage with a Mindbeacon therapist. So 21,000 people since the start of the pandemic, or since we launched with the Ontario government, which was about a year now. And we've seen about 16,000 people discharged from the therapy. So that just gives you an idea of the need. And these are people that are reaching out and looking for this type of service. And if you think about, the amount of people that aren't reaching out, there is, quite a bit of talk, or more importantly, studies out there, one from Deloitte that I can think of right now, where they're predicting that we're going to have this mental health tsunami. And that's the reason why, we continue to reach out to organizations, whether it be municipalities or private corporations, because that mental health tsunami it's coming, and it's coming fast, because as we know, the province is opening up, the Canada is starting to open up slowly. And we'll see that anxiety is still there, where people aren't used to seeing other people, the reality, and they may get anxious, from that, or, suffer from other challenges. So hopefully that gives you an idea in terms of where we are. Again, 21,000, just over 21,000 people that have come onto our platform, and about 16,000 people, 15,000 people that have been discharged from Mindbeacon. And then just in terms of some support that we provide, so we do provide the mental health, the workplace mental health engagement tools. So whether it be videos, one pages, posters, digital banners, suggested wordings, everything is really there for the organization. And we like to, it needs to be turnkey. We don't, organizations don't need to recreate anything. We customize as we need to. So, organizations that have, for example, first responders, we've customized the material to them, to the first responders population. And then the other thing that people have access to, or organizations have access to through our workplace mental health engagement tool, is what we call we have webinars on a monthly basis. Some of you may have seen it come through your email, but a lot of these are open already, but these are all open to the organizations, and we do provide the sign up prior to, you know, the organizations that do sign up with us. They are all provided this upfront when they do work with us, so that they can share it with employees, you know, weeks before the actual webinar takes place. So these are our topics for the rest of the year for our webinars. And one of the areas that I will point out is the May one, which is managing alcohol use. We've just launched a protocol for alcohol. This has been 2 years in the making, and now we are seeing obviously individuals using this particular protocol, because we all know, you know, just from studies, from hearing that, you know, the alcohol sales have increased significantly, and people do need that extra, you know, guidance in terms of managing the relationship with alcohol. And then I'll finish off just in terms of where we are from a municipality supported program, where we are able to support organizations and municipalities. And because we do have a relationship with AMO, it is $3 per person per month, and that includes families. And the other thing, it's all confidential. It's you know, all the information is confidential for the individual. We don't share this information with the municipalities. And if we do have to share, it's all high level, it's all aggregated if we do provide any type of reporting. And like I said, it's $3 per person per month. That includes the families, and that is on a 12-month contract for municipalities. And then one last one is just in terms of you know, some feedback that we are getting from our users, particularly the trusted relationship, and also, you know, that personalized care that we're able to provide to individuals. So hopefully that's given everyone a good idea in terms of the updates at Mindbeacon, and also, you know, the offering, but more importantly, you know, that there is a mental health tsunami that's coming. And what we have seen is we've seen a lot of municipalities, not only, you know, within the cities, as well as small municipalities up north, you know, around east, west. We've seen a lot of municipalities sign up with us over this particular year. So Nick, I think I've right on time. I said I'd be about 40 minutes. I will open it up to you to see if there are any questions.
Sure. Thanks, Anthony, for the presentation. That's a lot of information for people to digest there. We have about 20 minutes before the top of the hour here, and if folks have any questions, there is that the Q&A button at the bottom of the screen, and I would encourage you to send those in. Maybe just to get things rolling, Anthony, I know that you mentioned the $3 per person per month cost, and you know, AMO was successful in negotiating a lower fee. And through that aggregation, I mean, even smaller employers can take advantage of this offering. Are there any other additional implementation fees that folks should be aware of?
Great question, Nick. No, there's no implementation. There's no implementation fee. And I will add, you know, what we have done, because we do feel that peer-to-peer is so effective. In that $3 per person per month, that also includes the peer-to-peer. Which I described earlier for organizations, and again, that's on a 12-month contract. But there's no implementation fee for organizations.
Great, thanks. Some other questions here too. Can a member access the program through their existing benefits plan provider?
Yes, they certainly can access it through their benefits plan provider. But what we do see is because it is a reimbursable benefit, we see people going on, and there's a significant amount of drop-off when individuals need to pull out their credit card to pay for the service, Nick. So it is available, but we do see a lot of drop-off, and the utilization when we help organizations promote it in that form, you know, through their benefits, is about 0.03%, so it's negligible. But when we do see, when organizations do invest in the employees and pay that $3 per month per employee for a 12-month contract, we see utilization sometimes at 6-7%. And that's what we like to see, because it's that early intervention prior to them going on, prior to them calling in because of an absenteeism for mental health. And they may not disclose that to you, and also prior to individuals going on disability, whether it be for short-term disability. So hopefully that's giving you more insight on that particular question, Nick.
Thanks. Some of the questions I have here, and again, I encourage folks on the line, don't be shy, submit your questions. Anthony's here to take them. I got a few others here, Anthony, that we could probably get to. Can you go into a bit of detail regarding the process on how a municipality can enroll in Mindbeacon? And is there an online portal that I guess their employees and staff can access?
Yeah, no, for sure. So in terms of signing up with Mindbeacon, and the process is, we have you'd get an account executive, and once we have the account executive and that meeting, we do set up a dedicated website for your organization, and it's all customized according to your needs again. And the employees would have access to that, and it's pretty self-explanatory just in terms of understanding that there is a link for, there's a website, as well as are also explained in terms of the different programs that you may have. What we have seen recently, Nick, just in terms of onboarding, is organizations are saying, well, we're going to invest in our employees. We're going to do the $3 per month, per employee per month. And how they can use their benefits is they can use their benefits by accessing live therapy if need be. So they are, paying for that live therapy on their own, but it is a dedicated website to the organization, and we do monitor in terms of, how many people come onto the website, how many times they click in terms of the assessment, how many people complete it, as well as, obviously the people that have go through the assessment and the therapy, and then we provide you with results, assuming that we have 20 or more people come on and complete the therapy.
Thanks, Anthony. So this question kind of gets to some of our more remote members that might experience connectivity issues. I know broadband is a huge topic that a lot of our members are dealing with these days, and with everything particularly going online during the pandemic. So if there are members that have connectivity issues accessing the service, are there any alternative ways to access? Can they call, for example?
Yeah, so that's an excellent question. So we do have other services through our CBT associates, where they can have a call with a registered psychologist. But what we have seen and heard of organizations doing, Nick, is having a dedicated laptop in an office where individuals can log on and do their therapy at any particular time. Which is, I've seen, we've heard of organizations doing this, because at the end of the day is we want to get our people the service that they need, and ensuring that that connectivity is there for them. A couple other things is, if, for example, you are in a remote area and you do get signal now and again, is if you are in crisis, so if individuals in crisis, is they just need to text the crisis line, and there's no, that will, whatever it is that they've said, that that'll get responded quite quickly with the crisis line. So that's the plus with the crisis support. But at the end of the day, we are here to support organizations. So wherever we can help, whether the ideas of having a laptop accessible to employees, hopefully we can hopefully we can provide you more creative ideas so that employees do have access to these type of services.
Thanks, Anthony. I've got a couple more questions from myself here. Still, folks, if you have any questions, please, through the Q&A button at the bottom of your screen, you can send them to me, and I'll read them out to Anthony. So we've had questions in the past about whether municipalities and their public health staff from their additional agencies and boards can access the Mindbeacon service through the AMO offering. Is that still on the table?
Yeah, absolutely. Yeah, we've had conversations with a few organizations, that are not directly connected to AMO, but are affiliated with a municipality. So we are there to support organizations that need that service, because at the end of the day, we want to ensure that people get that service that they need for their mental health.
Thanks. And I guess one last question from me. In terms of the data that's generated through the platform, assuming that all the data the residency is hosted in Canada, including backup servers as well too.
Right. Yeah. So all the data is Canadian. It resides in Canada, and there we know from a public sector, municipalities, government, they're very strict about that, and we continue to work with that particular protocol and compliance, because we believe that we need to ensure that everything is secure, HIPAA approved, as well as keeping all personal information in Canada under the security that we need.
Thanks. So seeing that there aren't any further questions, I guess I can wrap things up and give folks an additional 10 minutes of your lunch break. And thanks for those that have stayed with us. If you're interested in the Mindbeacon platform and how it can help you, please reach out to Anthony. His contact information is there on the screen. Drop him an email or give him a call, and he'll happy to discuss the Mindbeacon offering and how it can be implemented within your municipality. So I guess that will conclude our webinar for today. And if you've enjoyed what you've heard, please click subscribe on our YouTube channel, and you'll receive the latest updates on the activities of the association, as well as past AMO webinars like these with Mindbeacon, and updates from our AMO president on the work that's been happening with the AMO board of directors. So thanks again to Anthony for the presentation today, and thank you all for listening and participating, and take care and be well, everyone. Thank you.
Thank you.